Welcome to Psych with Sigmund, where we explore the fascinating lives and contributions of influential figures in psychology. Today, we're going to delve into the life and work of Joseph Wolpe, a pioneer in the field of behavioral therapy. Joseph Wolpe was born on April 20, 1915, in Johannesburg, South Africa. His early life was marked by a curiosity about human behavior, which was encouraged by his parents. Wolpe's father was a successful businessman who valued education and supported his son's interest in psychology. As a young man, Wolpe was particularly drawn to the work of Sigmund Freud and Ivan Pavlov, whose ideas about the unconscious mind and classical conditioning laid the foundation for his future research. Wolpe's educational journey took him to the University of Witwatersrand in Johannesburg, where he earned his medical degree. During World War II, he served as a physician in the South African Army, which gave him valuable experience working with patients who suffered from anxiety disorders and other psychological conditions. After the war, Wolpe moved to England to pursue further training in psychiatry at the University of London. It was during this time that Wolpe became increasingly interested in behavioral therapy, which emphasized the role of learning and environment in shaping behavior. He was particularly drawn to the work of John B. Watson, who had founded the Behavioral School of Psychology in the United States. Wolpe's own research focused on developing techniques for treating anxiety disorders, phobias, and other conditions using behavioral methods. One of Wolpe's most significant contributions to psychology was the development of systematic desensitization, a technique used to treat phobias and anxiety disorders. This approach involves gradually exposing patients to the feared stimulus while teaching them relaxation techniques to manage their anxiety. For example, if someone has a fear of snakes, they might start by looking at pictures of snakes, then progress to watching videos of snakes, and eventually work up to touching a snake in a controlled environment. Wolpe's work built upon existing psychological frameworks, but it also challenged some of the prevailing views of his time. He argued that behavior was not solely determined by unconscious forces or instinctual drives, as Freud had suggested. Instead, Wolpe believed that behavior was shaped by learning and environmental factors, which could be modified through behavioral techniques. Throughout his career, Wolpe conducted extensive research on anxiety disorders, phobias, and other conditions. His work was influenced by the historical and cultural context of his time, including the rise of behavioral psychology in the mid-20th century. Wolpe's ideas were also shaped by his experiences working with patients from diverse backgrounds, which helped him develop a more nuanced understanding of human behavior. Despite the significance of Wolpe's contributions, his work was not without controversy. Some critics argued that his approach was too narrow, focusing primarily on behavioral symptoms rather than underlying psychological causes. Others questioned the effectiveness of systematic desensitization in treating complex conditions like anxiety disorders. However, Wolpe's legacy has endured, and his techniques remain widely used today in the treatment of anxiety disorders, phobias, and other conditions. His work has also influenced the development of cognitive behavioral therapy, CBT, which combines behavioral techniques with cognitive restructuring to help patients manage their thoughts, feelings, and behaviors. So, how does Joseph Wolpe's work relate to our everyday lives? Understanding his theories and techniques can help us better comprehend human behavior, thinking, and emotions. For instance, systematic desensitization can be applied to a wide range of situations, from public speaking to social anxiety. By learning to manage our anxiety and gradually exposing ourselves to feared stimuli, we can become more confident and resilient individuals. Wolpe's work also highlights the importance of empathy and compassion in therapy. He believed that therapists should work collaboratively with patients, helping them to identify and challenge their negative thoughts and behaviors. This approach emphasizes the importance of building a strong therapeutic relationship, which is essential for effective treatment. In addition to his professional achievements, Wolpe was known for his warm and engaging personality. He was a dedicated teacher and mentor, and his students and colleagues remember him as a kind and supportive figure who was always willing to offer guidance and encouragement. If you enjoyed learning about Joseph Wolpe, make sure to like, share, and subscribe.